Happiness starts with good health. Good evening and welcome, dear friends. This is Meenakshi Sharma back again with yet another new episode of BMC Global Live AlHilal Health World, nothing but lifestyle. Every week we invite and interact with highly qualified doctors and discuss some various important health topics. Today's topic for discussion is oral health. And to throw more light on today's topic, we have with us Dr. Komal Sharma from AlHilal Hospital, Muharrak branch. She is a specialist endodontist having over 16 years of work experience. So let's welcome Dr. Komal Sharma. Good evening, doctor, and welcome to the show.
Thank you.
Doctor, as you know, today's topic for discussion is oral health. So we would like to know first how important is oral health for an individual and what are the common mistakes made by people regarding oral health?
I feel oral health is like a mirror or a reflection to your overall body. So anything, any findings, anything concerning in your to your oral cavity should not be ignored, and should be taken as an indicator for any other systemic conditions which are going on in your body. So I think to keep your oral cavity in check is important, but at the same time, any findings in your oral cavity should not be ignored. I would also like to add to this that nowadays people have become very aware and they are doing quite a bit to take care of their oral health, oral cavity. But at the same time, there are certain mistakes which people are making unknowingly. So a few common things which, few common things which people often come to me with, few of the most common things, like people would say that, doctor, we are brushing twice a day and still we are having cavities in the mouth. So, and we are flossing, we are using a mouthwash twice a day. So here what I commonly tell my patients, I always tell my patients that you are focusing only what you're doing in the morning and what you're doing at night. So what all is happening to your oral cavity in between is something that we don't pay attention to, because we are so busy with our daily showers and works and stuff that we don't have the time. Plus we generally think that once we have brushed in the morning and night, we are sorted. So here I would like to add that a lot of times, throughout our day, during our meals, in between meals, snacking, and also, the number of times we are taking sweet, which is tea, coffee, could be anything. So all these are affecting your oral cavity. So one simple solution to this would be that we generally do not make it a point to rinse our mouth after whatever we take in during the day, that is after your in between the morning and the night session of oral cleaning. So it's very important to simply just rinse your mouth and keep your cavity clean. We should make sure that there is nothing sticking inside our oral cavity. Even so, I would like to add that more than the solids that we take in, it is the sweet liquids which are the culprit. So causing caries. So this is something most of us do not take into consideration. We do not take this seriously.
Like we ignore, you mean,
exactly.
Because in between morning and before sleeping, it's okay if you are brushing, but in between whatever we are eating, we have to rinse.
Yes, absolutely,
at regular intervals.
Yeah, this is equally important as much as your 2 times of brushing.
Okay.
Then I would also say that people nowadays have the tendency to just jump to more aggressive treatment procedures. So for even for something simple, people would just say, okay, doctor, let's just remove the cause, let's just remove the tooth, or we will just put a cap on the tooth, or we will just, they want to switch to, let's just treat this with laser, let's just treat with this with a surgery. So people who, I think it is one of the side effects of all the awareness going on, all the information which is there on the social media, that people have this tendency of picking up the most aggressive kind of treatments. So here I would like to add that it's a very good thing to be conscious and to be aware, But at the same time, I think it's very important, or what we follow in dentistry now is to be conservative, to pick up conservative treatment modes. So I think that is very important. So in a nutshell, I would say that nowadays clinicians prefer to start with the least invasive to the most invasive. So the idea is to conserve, your tooth structure, your natural components of the oral cavity as much as you can. And then of course, if you have to switch on to the higher treatment procedures, surely it will be required, but it is always good to be conservative with your approach. So I think it's important for the patients also to know this, that if your clinician is advising you to pick up something that is least invasive, then that is recommended, and that is the thing which should be done, rather than just jumping or switching on to the invasive procedures.
Absolutely. Like rather than jumping onto as you mentioned, onto like higher side of the doing treatments and surgeries and operations. So to avoid that, first of all, we should do the basic things which are necessary.
Yeah, true.
Yes. Okay, doctor. Now we would like to know what are the recent treatment modalities and procedures involved in oral treatment.
We are nowadays using few of our latest equipments and few changes in our treatment modalities, which has not only made our treatment plans easier, less invasive, and more comfortable for the patients as well as the clinicians as well. So few of which are use of lasers in dental procedures, implants, as most of us have heard, Hollywood smile, and tooth whitening. So these are few of the things which are improvising the aesthetics, the quality of aesthetic treatment that we usually give, and also they are very patient friendly. So I think talking a little about each one of them. Now lasers is basically we are using in a lot of treatment areas. There could be minor surgeries, even to take care of tooth sensitivity. So there are various kind of lasers that we are using which are available, and they are again, it depends on the kind of treatment that we are doing. We have to pick up those kind of lasers. And then we are talking about Hollywood smile. So basically Hollywood smile, again, it is a group of procedures when put together. So it is, of course, as the name suggests, to improve the aesthetics of the patients, because everybody is now conscious of their looks, and then smile is a big integral part of your overall looks. So so as the name suggests, it basically improves your smile by the kind of treatment we do on the teeth as well as gums. Then we talk about implants. So I think now when a person loses the tooth, so there were different ways to replace or give a prosthesis. So this is again another way to give a prosthesis to a patient when the patient loses a tooth. But as we will talk about a little more in detail about it. So because which are the kind of patients where we can give in implants. And also another thing which is gaining a lot of popularity is tooth whitening or bleaching, as we call it. So again, it focuses more on aesthetics of the patient. It is basically lightening the color of your teeth. So again, they are, as everything else, it has its own indications and contraindications. There are selective kind of people where we can do it, and what are the results, as we say, may vary. So we will talk about each of them in detail in a while.
Okay. That's very good information that you are sharing with our viewers, doctor. And dear viewers, there is a lot more to know about oral treatment from Dr. Komal, but it's time for a short break. Stay tuned, we'll be right back. Welcome back once again. And we have Dr. Komal with us sharing some very important information on oral treatment. So doctor, as you mentioned about laser treatment, we would like to know what are the procedures involved in laser treatment, and what are the benefits and side effects of laser treatment.
Lasers, it's been over a decade now that we are using lasers. We are including it in a lot of our treatment plans. So I think we have different types of lasers which are available. We have soft tissue lasers and hard tissue lasers with different wavelengths. So they could be used for in the less invasive treatment plans, like just taking care of sensitivity or small cavities. But at the same time, and also for treatment of oral ulcers, these are the areas where they are showing good results. At the same time, they are used for higher treatment modalities. They are very successful in gum treatments, gum surgeries, soft tissue surgeries. That is where they are showing very good results, where it is, they reduce the bleeding, improve the healing time, so the patient recovers faster, he is very comfortable. So I think, but again, this is basically decided by the clinician, which are the areas, which are the treatments where they will actually show good results. So, a lot of people who come to us and they say that, can we do this procedure? Can we do a root canal using a laser? So, it's very important for people to understand that yes, it is good to include, latest treatment modalities. But then it is important for them to understand that it is always a mix of the contemporary and the latest ones. So there are certain procedures where only a part of it, there's only a part of the treatment where we can include laser. But laser as such is not a way to take care of the entire treatment procedure. So if supposing we are doing a root canal, so we are not doing a root canal only using a laser. We are only using it in a small part of the treatment. Like it is very good for disinfection during the root canal procedure. So, but there are areas where it can be used as a complete treatment procedure, like taking care of oral ulcers, or even when we are doing gum surgery. So it's not that we are carrying out the entire surgery with laser. It is only included in a certain part during the surgery. So patients need to understand that lasers are included to improvise the treatment, to show better results. But it's not that we are carrying out the entire procedure with laser. So people do have a lot of myth which is associated with laser. So it's important for them to be educated about lasers. So I think, and of course, lasers can have some side effects like all other treatment procedures. So, and then again, it depends on the expertise of the clinician and also the response, the immune response of the patient. So a lot of factors are involved in it. So it's important for the, the patients to be educated about the procedure, and also patients should be aware that which are the areas where it can be included and which are the areas where it will show good results.
Okay. You mentioned about tooth whitening also as one of the modalities. So how effective it is, and what are the indications and contraindications related to that?
Tooth whitening, I think there was an era where almost every patient coming to us wanted to get a tooth whitening done, wanted to get a bleaching done. And sometimes the expectations of the patients can be unreal, So it's important for people to understand that tooth whitening and bleaching is basically, it's lightening the shade of your teeth. But then till what extent it will lighten depends a lot on your actual shade of the tooth, the structure, so the results can vary. So it's not that all patients will get a similar result. So you have to be realistic. So depending on the patient, we need to see how much the shade can be lightened and how much of it is healthy for him. Because it's a common side effect which we also inform the patient before we start doing tooth bleaching is sensitivity. So we have to take care that, whether we need to take a good history, that whether patients, are they suffering from hypersensitivity, tooth hypersensitivity, or some patients, there are certain intrinsic strains, which is internal discolorations, which do not show very good result with bleaching. So and plus there are certain teeth, certain kind of teeth and certain kind of I would say discolorations, which do not show any result with bleaching. So we have to be very selective when we pick up cases for tooth bleaching. So again, as I mentioned, that it is important that the patients should be educated, so their expectations are real with tooth bleaching. And of course, sometimes there can be some side effects, which eventually settle with over a period of time. And of course, we do give some patients some over-the-counter medicines and gels to take care of sensitivity, but then they do settle with time. But again, it's important for patients to have real expectations with bleaching.
Okay. As one of the modalities, implant is also there. So can you tell us more in detail about implants?
Implant is it's a prosthesis. It's a replacement that we give once a patient loses the teeth. So it's a replacement wherein it's a fixed replacement, and wherein we are not touching your adjacent teeth. So it's basically a screw which is put in your bone, with the support of which we give a replacement or a prosthesis or an artificial tooth that is put in your mouth. At the same time, I would also want to add that there are a lot of contraindications. There are a lot of areas where implant may not be suitable for a patient. So we have to take care, we have to take into consideration the bone health of the patient, the gingival or the gum health of the patient, the systemic health of the patient, because it will not show, it will be a failure in patients where the bone or the gum health is not good, or if the patient is heavily diabetic, or if the patient is a very heavy smoker. So in such case, sometimes it can lead to failure, sometimes it may not give a good result. So of course, it will be decided by your clinician whether it is suitable for you to take implant as a replacement. But yes, it is a good option to give a replacement for a missed tooth. Again, if your oral cavity is suitable for it, is suitable to accept it.
Okay. So is there any side effect also of implant?
Well, there is no real side effect, but as I said that in some cases implants can be a failure. They might not survive very well in your oral cavity for a number of reasons, because a lot depends, as I said, on the patient's oral habits, oral hygiene habits, his gum health, his systemic health. So all these are factors in which the patient again has to do his part of the job. He has to take care of his share of the responsibility as well. So no real side effects as such, but yes, again the results can vary.
Okay. Doctor, as you mentioned about Hollywood smile, everybody wants a beautiful smile on their face. So how effective it is, and what is the treatment involved in this procedure, and can you tell us more in detail about Hollywood smile?
Hollywood smile, I would want to add that people do have some misconceptions about Hollywood smile. Now, Hollywood smile involves a few set of procedures, and it involves multi-specialities, wherein it can be changing the structure of your teeth, also your gums. So it can, depending on the condition of the oral cavity, depending on the severity of the case, we have to decide on the kind of changes we have to make. So sometimes it is about giving, just about giving veneer to your teeth, which will make your teeth look more structured. Of course, there will be a uniform shade which will be given to at least all of your front teeth. So that will be, the first part will be giving veneers. But at the same time, sometimes it is about making changes to your gums as well. because some people, you know, they have, when they smile, more part of your gums are seen, which can affect your smile. Some cases, the amount of gums which are seen during a smile is less, so it is more of your tooth structure which is seen. So it's about balancing the two. So, you know, it looks more synchronized. So when you smile, it is even both on the upper and the lower jaw. So it's not, it's a decision which has to be made by the clinician, wherein whether they would only alter the structure of your teeth or they would also make changes to your gum. And then all this has to be the treatment plan, the time of the treatment, the cost, all this has to be decided depending on the severity of the case. And it might not be a single session procedure. It can take a number of sessions and a number of weeks for the treatment. You know, supposing you're undergoing a gum surgery to change the length of your gums which is shown. So that might take some time to heal, and only then they will go to next part of the treatment. So it is not something that is going to happen overnight. It will not happen overnight. So this treatment procedure might happen over a number of sessions, and it might take some time to basically get stabilized in your mouth. So again, as I said, like all other procedures, the patient needs to understand and needs to have a realistic approach and realistic expectations with the procedure.
Okay. Dr. Komal, you have given such a detailed information about oral treatment, the recent modalities and the procedures involved in it. So before we conclude our today's episode, what advice or tips you would like to share with our audience as a takeaway?
I would really want to emphasize on the fact that, you know, oral health, overall taking care of your oral health begins at home. So I think the basic few efforts has to be done by the patient. So I think that goes a very long way, and that plays a very important role on the overall oral health. So it's at very small stages where we would see people becoming careless, people becoming ignorant. So which leads on to, issues which sometimes could be irreversible. So I think it's very important for us to just take out few seconds, few minutes and some little time for our oral health. And I think that would save us a lot of trouble in future. So I think it's, as I said, it's very important for us to take care of our share of responsibility and do our little bit.
Thank you so much, Doctor, for coming and sharing such valuable information. And I hope our viewers, they must be getting benefit out of this in some or the other way. Thank you so much once again for coming. Thank you so much. Dear viewers, oral health is a mirror to general health. And please don't ignore that. On this note, this is Meenakshi Sharma signing off for this evening. Till we meet next week, same day, same time. Take very good care of yourselves and your loved ones. Stay safe, stay happy, stay healthy. Good night.